Begin the examination of the ear by inspecting the auricle and surrounding tissues for deformities, lumps, or skin lesions. If ear pain, discharge, or inflammation is present, do the tug test to test for otitis externa or external otitis. Move the auricle up and down, press the tragus, and press firmly on the mastoid bone behind the ear. Tenderness here suggests mastoiditis. Next, examine the ear canal and eardrum using an otoscope. To do this, select the largest speculum the patient's ear canal will accommodate. Position the patient's head so that you can see through the otoscope comfortably. To straighten the ear canal, grasp the auricle firmly but gently, and in an adult, pull it upward, back, and slightly away from the head. Insert the speculum gently into the ear canal, directing it somewhat downward and forward, bracing your hand against the patient's face. Note any cerumen or earwax that may impair your view. Also, observe for any discharge, foreign bodies, redness of the skin, or swelling. Maneuver the speculum until you can see as much of the eardrum as possible, including the pars flaccida, if possible, and the margins of the pars tensa. Note the color and contour of the eardrum with its distinct cone of light. Normally, the drum is pearly gray. Also, note the position of the handle of the malleus and inspect the short process of the malleus. The handle of the malleus, with the umbo at its tip, crosses the eardrum obliquely from the cone of light upward toward the short process. Be sure to examine the other ear in the same manner. To assess hearing, ask the patient,
"Do you feel you have a hearing loss or any difficulty hearing?"
If the patient reports hearing loss, proceed to the whispered voice test. To assess hearing, test one ear at a time. Stand 2 feet behind the seated patient. Occlude the non-test ear of the patient with your finger and gently rub the tragus in a circular motion to prevent transfer of sound to that ear.
And now tell me what I'm saying.
Exhale fully to ensure a quiet voice, and test the open ear by softly whispering a combination of 3 numbers and letters. Gradually increase your volume until the patient can identify your words. If the patient responds incorrectly, test a second time with a different number-letter combination. In a normal response, the patient will repeat at least 3 out of the possible 6 numbers and letters correctly. Repeat on the other side. For patients failing the whispered voice test, a tuning fork test helps determine if the hearing loss is conductive or neurosensory in origin. In a quiet room, select a tuning fork of 256 or 512 Hz, as these frequencies fall in the range of conversational speech. Set the fork into light vibration by tapping it on your hand. Test for lateralization by performing the Weber test. Place the base of a vibrating tuning fork firmly on top of the patient's head or on the mid-forehead. Then ask,
"Is the sound louder in one ear or the same in both ears?"
It's the same in both ears.
Normally, the sound is heard in the midline or equally on both sides. Next, compare air and bone conduction by performing a Renee test. Place a lightly vibrating tuning fork on the mastoid bone behind the ear and level with the canal. When the patient indicates that the sound is no longer heard, quickly place the vibrating fork near the ear canal and ask if the sound can be heard. The U of the fork should face forward, maximizing the sound for the patient. Normally, the sound can be heard longer through the air than through bone. Be sure to test the opposite ear. Remember that a clear, well-organized clinical record, employing language that is neutral, professional, and succinct, is one of the most important adjuncts to patient care.
The skull is normocephalic and atraumatic. Hair has average texture. Eyes with visual acuity 20/20 bilaterally. Sclera white, conjunctiva pink.
After practice and further review of this video, make sure you have mastered the important learning objectives for examining the patient's head, eyes, and ears.